This week, my husband's company sent us an email letting us know that the cost of our health insurance premiums were going to go up for the next year if we wanted to keep the same plan that we were already on. They were kind enough to include a little note that said, hey, we also raised our prices just a little bit because, you know, the billionaires running the insurance companies wanted to buy a 12th jet. Just kidding. They didn't say that last part, but they did let us know that there was going to be a price increase. And today we're going to discuss the absolute catastrophe that is the United States health insurance industry. This video has been a long time coming. I have a lot of opinions and feelings. This will be the first in a series where we take a look at how broken our healthcare system is and how it got this way and how it affects so many people. And this isn't political, this is just people, not politics. So that if you don't see this firsthand, you can gain an understanding and hopefully a desire to fix it, because it cannot continue like this. And again, this isn't political, this is just about people and caring about people. If you're wondering, like, continue like what? Well, for starters, I am a nurse practitioner and my husband is a software engineer, and we cannot afford to have health insurance next year unless we change jobs or win the lottery, because it's $26,000. For real, for 1 year, for next year, it's $26,000. Now, let's take a look at how that happens and how this is happening everywhere in this country to so many people, and this is not okay. All right, welcome. What an entrance. If you're new here, I'm Liz. I am a family nurse practitioner, and I spent 3 years working in primary care before I left because I literally just could not handle how much insurance, one, dictated how I could do my job. It had me giving like unethical care and just dictated everything I needed to do. And two, I couldn't handle how no one could afford the suggestions that I made or the treatments I recommended or the treatments they desperately needed because they couldn't afford it, either because they didn't have insurance or they had insurance, but they couldn't afford the deductible, which is what you need to pay in order to have your insurance company start paying for anything in your healthcare. So I left primary care a few months ago in an absolute rage, and have now decided to try to raise awareness for this so I can do something with my rage, and so that you can be just as mad as me and that we can change our healthcare system, because it is not working, okay? It is not, as someone who's worked in it for years, it is not working. So when did this start to not work, and why isn't this a problem for other countries? So for this, we're going to actually go back and we're going to take a historical perspective. We're going to go back a wee bit. So let's go take a look. In ye olden times, when people got sick, doctors came to people's houses, and then the people paid the doctors, and there were very few hospitals. Most of them were run by churches, but they were really mostly honestly just good at killing you faster than you would have probably died if you were at home, because the scientific process wasn't sorted out. They were trying to figure out everything out. They hadn't figured out germ theory yet, so they were just using like nothing was cleaned. It was a mess. So it was actually best if you probably stayed home and tried the remedy your local doctor gave you. This obviously benefited people with more money who could afford to pay a doctor. And if you couldn't afford to pay a doctor, well, you should probably just try not being poor. Clearly it was because poor people were lazy, and lazy people don't deserve to be given the privilege of accessing care that helps them stay alive. As you can see, some things never change. But more on that later. So in the 1910s, 1920s-ish, some companies and labor unions started to offer assistance for paying for medical care. But it was not really commonplace for that to happen until after towards the end of World War II. In 1943, President Roosevelt put in place a sort of like freeze on wages because there was not a lot of money going on because there's a war happening. But jobs still needed a way to incentivize people to come and work there, but they couldn't use salary. So they leveraged something else, the ability for people who could work there and their families to have access to something they might not otherwise have access to, medical care. And the insurance companies then needed to be born to offer this kind of as the middleman between the people, the healthcare, and the insurance, how they're going to get it. So the insurance companies were born, and they became widespread because someone needed to handle the transaction of exchanging the money for the healthcare. And it worked. People ended up taking jobs that they otherwise might not have taken because the great pay wasn't that great, or they just didn't like that job, but they wanted medical care. So they were willing to make that compromise. And it slowly became more and more common for even more exclusive jobs. So if you had a very specific job that was going to need a very specific person, they would start offering health insurance to lure in really quality candidates when there were not a ton of, options available, and they really wanted to be able to draw the good people in. And you might be sitting there and saying, but Liz, that makes sense. There was no money and they needed an incentive. So this seems like a good idea with good intent. And to that I say yes. At the time, it was honestly a really decent solution to a problem, but that wage freeze that started this, it stopped. Guess what didn't? The insurance system. Did some people have objections to all of this, saying that this was largely unfair and could be used to manipulate people into staying into low-wage jobs or jobs that treated them poorly, just for the sake of having health insurance? Of course. So how did private insurance companies who profited the most from the system convince the general public that this was just okay? It's a great question. And to here we can kind of look at the lobbyists and how they positioned all of this. So lobbyists told voters that this was in their best interest. You see, they didn't want socialized healthcare like Germany had, those evil Nazis. Slogans like political medicine is bad medicine were started. And if I may be so bold, this continues to be the fear-mongering tactic we still see to this day. We don't want any kind of socialized medicine. The word communism is thrown around a lot. It's perfect the way it is. It would, a lot of fear around if we changed it, it would be so much worse. I think you've probably heard that before. So back to history. Noting that this system was leaving quite a few people still without healthcare, President Truman began talking about the idea of having a government-funded health plan in the late 1940s, the rest of the developed world was doing at this time, because they realized that humans are inherently valuable and worthy of things like access to healthcare. But he was met with opposition from the unions, the doctors, and the hospitals, because they very, very much liked how things now were going. Also the insurance companies. The insurance companies were also obviously quite thrilled. There was, at this point, nothing dictating how much a doctor could charge for visits. Same for the hospital. So they certainly didn't want to switch to a medical model that would be where they would be reimbursed by a set fee that was set by the government and could be controlled that way. And how would unions be able to kind of get people in and negotiate and get people to work crappy jobs if they didn't have the perk of, well, at least if you get sick, you can at least get medical care to dangle over people's heads. All of the attempts, and there were a lot, California tried at one point, so many different places and cities and states, they tried to make a single payer government funded healthcare system, and they all failed because over and over again, the rich medical providers and the healthcare systems and the unions, people with money, therefore people with power, would lobby in favor of making themselves more money at the cost of these human lives. And as the lobbyists became more wealthy, they were better able to push the narrative of fear onto the general population. They were not pushing facts. They just kept pushing the same line. You don't want to be socialist. And throughout the years, that narrative has stayed the exact same. Like I said, it's just changed to whatever country. It's not Germany anymore. We're not you don't want to be like Germany. Now it's put in the country that we hear about all the time. You don't want to be like that. American medicine is better. It's the best. We'll just keep it like it is. Our wait times are shorter. We're going to discuss that later. But there's been a narrative of fear the entire time that things are better like they are now, even though we've never experienced the other one and we don't want to be socialist. So let's fast forward a little bit to the 1960s and what happened between the 40s and the 60s. It just kind of kept getting worse. People were just being greedy. In 1965, tensions in the healthcare were reaching a true boiling point, really in the whole country in general. Those without health insurance were dying because they couldn't afford health insurance, similar to how it always really has been. And even though they had jobs, they didn't necessarily have in-demand jobs, so those jobs did not need to incentivize people to come work there with things like benefits. It was also still a thing in the 1960s that if you were Black, and really most minorities, you could not go to to the white people hospital. Hospitals were super segregated, which is just blows my mind that like when my parents were alive, hospitals and places were segregated. It's difficult for me to wrap my mind around. And when you went to the hospital, if you weren't white, you were in a different wing or a basement, and the medical care you received was immensely subpar. I actually have a whole video kind of talking about that and racism in healthcare. If you would like to watch, I will leave it linked down below. It is happening. And we need to address it. But, if you were not, born wealthy or white, or at a job that provided you health insurance, you had no other option at this point. Kind of like now. So in 1965, to try to address this, Medicaid and Medicare were formed. And one of the requirements of creating Medicaid and Medicare was that they were going to require the hospitals to desegregate in order for them to get federal funding. And if they didn't, then they weren't going to get any money. So that was a really big motivator because remember, healthcare always likes money. And this was an immense breakthrough for older patients who could now get Medicare, individuals living on very little income who could get Medicaid. And this would hopefully start to desegregate medicine just a tiny bit. At least it was the first step. There was something in the right direction. Not ideal, but the right direction. Unfortunately, it still left out a massive middle ground of people in the United States who still didn't qualify for Medicaid, but they also couldn't really pay for health insurance, or they weren't at one of those jobs that incentivized people coming there with health insurance. So there's kind of the middle there. And does that sound familiar? Okay, so that was kind of when our first, sort of some kind of state-funded healthcare came into the scene. So we have now figured out how we ended up as the only industrialized country without single-payer healthcare system to exist. That doesn't just give healthcare to people because they exist. But how did we get to the place where insurance companies now can not only charge us insane amounts of money to have access to healthcare, but they also can dictate our care? That arrives with the implementation of HMOs, health maintenance organizations in the 1970s. At that point, it really became legal for HMOs to offer insurance and operate in a system where there were set guidelines in place of how to manage every condition, and the providers within the system are given parameters of how to practice medicine. It will not shock you here to learn that these guidelines were put in place to save as much money as possible. They're still very popular today. And even if it's not the best treatment for the patient, it also will not come as a surprise that all humans are not the exact same. And so they probably shouldn't receive the exact same medical care. And it doesn't necessarily have the best outcomes. So we don't even have the best of both worlds. You can't say oh, well, it's at least, we don't have nationalized healthcare, but that means we're not working within their parameters. No, we don't have nationalized healthcare, and we don't have the freedom of choice as healthcare providers to make our own decisions. So that is how we not only have the most expensive healthcare system in the entire world because it's driven by profit, but also how we manage to have the poorest health outcomes because insurance companies don't allow for individual provider discretion, leading to mismanagement of patients if they don't fit the model. And there's all those people who fall into the no insurance hole or my deductible is too high hole. Those don't really help us with our outcomes either. And maybe we should look at those next real quick. So while I was working in primary care, I cannot tell you, and as a nurse, I cannot tell you how many people in the last decade of my life who were hardworking, excellent humans who made too much money to qualify for Medicaid, but who could not afford insurance. You might be like, well, how is that possible? That's not my reality. Well, let me use me as an example. My job does not offer insurance. So we get insurance for our family from my husband's job. My husband's job offers two types of insurance. Okay. First is a very cheap insurance that covers annual physicals. Awesome. But literally that is all that it covers. If you need anything else, if you need to go to urgent care, if you need to go to the hospital, if literally anything but a physical happens, they don't pay for that. And everyone in my family of four has some sort of a medical condition where they need to seek pretty regular care. And I can't tell the future yet to see if they will be requiring hospitalization. So that option is out. So we have the second option, the more expensive option. Our next option, like so many people out there, is a high deductible plan. If you aren't familiar with a high deductible plan, you pay a monthly premium to the insurance company to have the privilege of having insurance with them. Our monthly premium for this privilege is $1,333 a month, so $16,000 a year. And you might think, wow, you are going to have amazing insurance with that cost. I bet they even cover massage therapy, chiropractors, all of that. And oh, friend, you could not be more wrong. So with a high deductible plan, after paying $16,000 just out of the gate for the honor of having health insurance, if we dare use our insurance for anything other than physical exams, we must then pay out of pocket until we reach our deductible. So this is for things like my daughter gets sick, has to go to the doctor. I have to go to the doctor to get a refill on my Zoloft. These appointments when you run into your primary care are usually going to run you like $250 a pop. And that's for non-specialist providers. If you have to go to a specialist, like a psychiatrist or a gastroenterologist, it's like $350 and up. But don't worry, we only have to pay out of pocket until we hit our deductible. This sounds great. So what's our deductible? Oh, it's $13,000 because we are a family of 4. If we were a family of 1, our deductible would only be $7,000. So really, we are getting a great deal where we have 4 deductibles for the price of 2. Wow. Thank you, Aetna. And that, my friends, is how I cannot afford healthcare. Because if we combine the annual cost of our health insurance with our deductible, which we almost always hit because, again, we have a family full of people who utilize healthcare, it will cost us next year $26,000, which is more than a quarter of our income. So that's, and that doesn't include taxes or anything else. So that's good for 1 year of medical care for my family of 4. And this is not just me. And that's why I'm making this video, because it's not me complaining and saying, oh, woe is me. This is millions of people. This is countless patients being able to not go to the cardiologist for their heart murmur because they haven't reached their deductible yet and they simply cannot afford it. This is cancer patients denying treatment or denying palliative care and asking me not to tell their wife because their credit cards are already maxed out and they cannot get a loan, so they cannot pay their deductible, and they would need to declare bankruptcy in order to proceed to treatment. And if they don't live, they don't want to leave their wife a widow and in bankruptcy. So they just decide to die from treatable cancer so that their spouse can live without that burden. I have seen that more than once. I have seen people die in pain because they don't want to hit their deductible to pay for palliative care. And if you tell me that that is a lie, you are wrong. I have seen it and you are wrong. It does happen and it happens often. This is... we're not going to cry. This looks like sitting in your OBGYN's office after your first ultrasound. This happened to me with your tiny little poppy seed sized baby in your belly, a time that should be really joyful. But instead, you are in tears in the financial office because that's where they direct you after your ultrasound. They're like, oh, it's confirmed. Okay, come down to this office. And they go in and you realize you have to pay them $13,000 to have this baby. And they would like $7,000 of it next week. Don't worry, they offer payment plans for your baby. And it takes most people, most of my friends, we're still paying off the birth of our children. And that's not okay. This is people paying their $13,000 deductible for their D&C after their miscarriage. They don't even get a baby. They just get a bill. This is patients not treating small problems because the cost is too high for a visit, only to come into the ER months later with a now incredibly serious and life-threatening complication of a disease that could have easily been treated, preventing this entire situation if only they had had access to care a few months before and could have had it dealt with then. This is coming off of medication for crippling depression because you cannot pay for the office visit that you need to get a refill and you haven't met your deductible. I've done that. It was not fun. It didn't go well. This is stretching your insulin because yes, medications apply to this too. You have to pay out of pocket until that deductible kicks in. And since you obviously chose to be born with type 1 diabetes, then you get to pay the $13,000 deductible every single year to cover your medicine before anyone else will pay if you work somewhere that has a high deductible plan. This is not working for 90% of the patients that I see. I don't have hard statistics on any of this because it is just my experience. We don't collect data. We have data on how many people have insurance, but we have no data barely on who is able to utilize their insurance. I spent 75% of most of my appointments in primary care trying to figure out how the heck am I going to get treatment for these people, or fighting with insurance companies who didn't want to provide the treatments to the people who needed it. When we finally did meet their deductible, we're like, we got here. And then the insurance company was like, no, try X, Y, and Z first. And then the year timed out and it started over again. Or I was spending time researching treatments that I was never trained to prescribe, didn't really feel comfortable prescribing because the patient could not go to the specialist that they needed to go to for this treatment. They could not afford it. And so without it, like, hey, they might die. So I guess I'm going to be looking into this with my collaborating physician, and we're going to be figuring this out. And I am not being dramatic. And I know people will say that I am. I know people will say that I am, but I promise you that this was seriously every day, almost every appointment. And it is absolutely heartbreaking. And I am angry. And I've tried for a long time to film this without being angry, but I think it's okay to be angry because this is not okay. And I'm sure that some of you are probably going to point out that this isn't every type of insurance. Not everything's a high deductible. And you're right. Some jobs offer awesome healthcare insurance. My old nursing job had incredible insurance. I paid very, very little for it. I paid $88 while I had it to have my first child, in comparison to the $13,000 I paid for my second child. People would drive for that job. They would drive like an hour and a half to work at that hospital just for the insurance. Yikes. They drove by like dozens of other hospitals to get to ours just for the insurance. Here's a fun fact. If you are a executive working at a company, this is also likely not a problem for you. Because companies usually have executive insurance policies where you don't have to pay for insurance and you don't really have a deductible either. And if you do, it's usually pretty low, and they usually throw a health savings account at you with enough money to kind of cover a good chunk of that deductible. I did not know that until my spouse worked in insurance, and he was like, did you know this was a thing? And I was like, excuse me. So these are people that are making a lot of the decisions because the executives have a lot of money. So interesting. Follow the money. There are also non-high deductible plans. A lot of people, PPOs. We don't have that option available to us though, but if they do exist, if your employer is willing to pay more on your behalf to have that option provided as kind of a job incentive, like they always have been, some companies will offer better insurance than others. They'll offer PPOs. They'll pay more for it, so you pay less out of pocket. But again, just work at a job that has that. It's so easy to find those, right? And then there's cost sharing insurance plans that act as a sort of insurance where they decide what they will cover. Most of these that I found are usually based on like a religious institution type of thing, and the cost is like shared amongst all the people. Like MediShare is a really popular one. This is totally fine if you align with those principles and are okay with those limitations. It can usually kind of get pretty expensive if you need certain other things, but I mean, for a lot of people, those do work. And then we have the healthcare marketplace, where people can go on and kind of shop for their own insurance if it's not provided by an employer. But the price range is usually kind of in the same ballpark as the plan that I described earlier that we're looking at. We searched all over for them, and we actually couldn't find a plan that was cheaper than our $26,000 plan. So bummer, dude. Good try though. Everything, they had it, but it was like catastrophic. So like, I was like, great, that's as if this isn't catastrophic. It's fine. And then there's people like, what if you just like literally can't? Those are the people who just can't afford it and they don't have insurance, and they show up at the ER when they are epically sick, unable to pay the $300,000 bill that they get after showing up and need an emergency surgery with the hospital say. So they have to declare bankruptcy to not die. And the hospital writes it off as a loss. And if you don't think that happens, the number one cause of bankruptcy in the United States is medical debt. People desperately trying to stay alive and destroying their financial world to do it. What a cute and fun American tradition. Yay. So what do we do? Let's change it. please, let's change it. And I know people are going to blow this off as your liberal scheme. But this is not political. This is people. Remember how this started. Lobbyists, people with a lot of money trying to get more money, and they would use scare tactics like don't be socialist like Germany in the 1940s. How many times have we heard single payer healthcare described today like that, as socialist, as communist, as something that would never work as well as our American system that is not working? People were using the fear tactics back in the 1920s. And it's like 100 years later, we can do better. We can open our eyes and see that every single other industrialized country has figured out single payer healthcare, and we can too. We can figure out how to implement a healthcare system that acknowledges everyone's right to receive healthcare because they are alive and living here without going, and they don't need to go bankrupt to do it. Like, can you imagine what if the most stressful thing about getting diagnosed with cancer wasn't how you were going to pay for it, but how you were just gonna survive? Like, as if it's not already stressful enough. Can you just imagine that and put yourself in the shoes of other people and see, oh, people deserve that. Even if it's okay for you, it is not okay for most people. And we will continue this conversation. This is something I'm hoping to have as like a multiple thing, address things from different angles. And if you have experienced a lack of healthcare due to a lack of insurance or a lack of an ability to hit your deductible, I am sorry. I have been there, I am there, and it sucks. And if you're comfortable with it, I would really appreciate if you left your experience below. It doesn't have to be details, but just general, the general gist. I have tried so many times to have this conversation with people, and every single time it comes back to the same thing. Our system is better. People don't have insurance because they won't have a job because they're lazy. Single payer healthcare is socialist or communist. If we switch to a single payer health system, the wait times will be too long. Side note, as if our wait times aren't already long, I have to wait 9 months to get to primary care. And have we ever thought about the fact that wait times would be longer if everyone had access to healthcare versus only those who could afford it? It's not necessarily that other countries might have slightly longer wait times because everyone has access. And it seems like everyone having access is an important thing in order to make things equal. Well, we're not always very good at making things equal, but I digress. So what would I love to see? I would love to see if we could stop with the kind of I got mine attitude. And what do I mean by that? I just mean, let's stop thinking, if this isn't an issue for you, then wonderful. But I have taken care of a lot of people, and I can tell you that this is an issue for a lot of people. They don't have access to healthcare. And I would love if you would help me spread that message. I think if we all talk about this, then we can really change it. I really think that. So please share this. Please share your experiences. Thank you so much. And thanks for listening to this. This is a people issue. And I so hope we can see it as that, as a people issue, and come together to fix it. All right. Thanks, friends. I'll see you next time. Sorry about the lawnmower also. There's people always mowing their lawns here. They're very into it. All right. Bye.